Welcome to your PEBT skill building lessons. We are glad to have you join us. This is the fifth in a series of learning opportunities, some self-directed, like this one, and others through Zoom or in-person sessions. Today's skill building session will help you develop the knowledge and skills needed to perform the duties of a PEBT benefits administrator effectively. In this lesson, we will focus on submitting claims for the cost-sharing medical monitoring reimbursements. Following this lesson, you will be able to identify eligible medical monitoring expenses for reimbursement, explain who is eligible, locate the appropriate forms and submission instructions, and apply the correct process for submitting claims, including timing and documentation requirements. In our context, we offer a cost-sharing benefit that reimburses a portion of medical monitoring expenses. Medical monitoring is done through an independent third party and includes randomized drug and/or alcohol testing and treatment monitoring to deter the misuse of drugs and alcohol, particularly in the workplace. It is frequently used when a member who has been absent to recover from addictions or substance misuse is on a return to work program. Our goal is to help members return to work safely for them, the district, and the students. The Public Education Benefits Trust, PEBT, will reimburse a portion of medical monitoring costs to ensure eligible K-12 unionized support staff members who are recovering from addictions or substance misuse have access to affordable medical monitoring services as part of their continuum of care. Eligible expenses can vary and may include things like substance testing and lab work, clinical follow-up, monitoring appointments, documentation, reporting, confirming attendance, and compliance. To be eligible for reimbursement, the medical monitoring services must be provided in Canada to an eligible member on behalf of a participating school district. An eligible member is defined by the Public Education Benefits Trust Core Long-Term Disability Program text and in the trust agreement and is suffering from an addiction or substance misuse that has been diagnosed by a physician and requires medical monitoring. School districts are encouraged to use medical monitoring companies capable of the following. Service is provided in Canada. They use a consistent process for computerized randomized testing, offers testing 7 days per week. Chain of custody protocols are provided. A certified medical review officer is involved to review all possible non-compliance tests, including a call to the member. They immediately report all confirmed non-compliance tests, regularly monitor all treatment recommendations with the member, including counseling, medication adherence, and program attendance, and provide monthly reporting on member compliance and progress. It is anticipated that the length of medical monitoring for a member will be determined by a member's physician and not the medical monitoring company. How much will the PEBT reimburse? We may reimburse 2/3 of the total cost to a maximum of $9,000 per member annually. Where the school district has paid 100% of the medical monitoring costs, any approved cost sharing will be reimbursed to the school district directly. Where the member has paid 100% of the medical monitoring costs, any approved cost sharing will be reimbursed to the member directly. Where the school district and member are sharing the costs of medical monitoring, any approved cost sharing will be reimbursed directly to each party, and reimbursement priority will be given to the member. Only when the member has been fully reimbursed will the remaining available reimbursement be directed to the school district. In extenuating circumstances, the PEBT may consider reimbursing more than 2/3 or more than $9,000 of medical monitoring costs per member per calendar year. This medical monitoring cost-sharing policy is not intended to replace arrangements already established by school districts. Let's check in on your learning. What is one thing to look for in a medical monitoring company? There are many things, including provides a consistent process for computerized random testing, offers 7-day-a-week testing, has chain of custody protocols, includes a certified medical review for noncompliance, immediately reports noncompliance results, regular monitoring of all treatment recommendations, monthly progress reporting, and the length of monitoring is determined by a physician. How much will be reimbursed? A. 2/3 of the cost with no limit. B. 2/3 of the cost up to $900 per member. Or C. 2/3 of the cost up to $9,000 per member with receipts. The answer is C. 2/3 of the cost up to $9,000 per member with receipts. How to claim for reimbursement. Consistent with long-standing best practices, the school district will select and contract directly with the medical monitoring company. At the end of each calendar year, or at the end of a member's medical monitoring, the school district or member may forward a completed medical monitoring reimbursement request form and a copy of the medical monitoring receipts to the PEBT for cost-sharing reimbursement. The medical monitoring reimbursement request form can be found on the PEBT website by clicking on the PEBT Program Benefit menu, then clicking on Member Benefits, and then on Medical Monitoring Cost Sharing. Completing the reimbursement request form. The forms must be fully completed to avoid delays with reimbursement. Please include the member's name, employee number, district number, address, and date of birth. Please also include the effective date of the member's LTD coverage. This is not the date they are approved for LTD claim benefits. This is the first date they were covered under the core LTD plan. The information required on the form regarding the actual expenses includes the date of the expense, who the expense was incurred by, the district or the member, and the expense amount. If the expense was cost shared between the district and member, please include the full cost of the expense and include in the incurred by field how much was paid by the district and how much was paid by the member. Reimbursement will not be provided if receipts are submitted more than 90 days following the end of the calendar year in which the expense was incurred. Submitting the reimbursement request form. To protect the member's privacy, do not email the form to the PEBT. Please upload the form to our SharePoint site and then email us at lori.lofthog@pebt.ca advising of the submission. With the form, please include medical monitoring payment receipts and invoices. If these receipts do not show proof of payment, please also include documentation from your accounting system showing the payments made. If you don't have access to the PEBT SharePoint site, please contact us at lori.lofthog@pebt.ca to request access. Once your email advising the form and documentation have been uploaded, the PEBT will review and let you know if they have any questions. You will receive a confirmation email outlining the amount eligible for reimbursement and the date reimbursement will be made. Reminder, reimbursement will not be provided if receipts are submitted more than 90 days following the end of the calendar year in which the expense was incurred. If the district and/or the member is requesting PEBT reimburse more than 2/3 the cost or more than $9,000 per year, detailed reasons for the request will be required and can be provided on page 2 of the form. These requests are reviewed by the PEBT board, and a decision will be communicated to the district and/or member once a decision is made. If the request is not approved, an appeal can be submitted by the member or the district to the PEBT within 2 years of the decision date. The appeal will be reviewed by the PEBT trustees, and a decision will be communicated to the member and/or district. Please include your name, phone number, and organization at the bottom of the form in case the PEBT needs to contact you for more information. Let's check in on your learning. How do you submit your request form? A. Attached to an email. B. Through the secure SharePoint. Or C. Through the secure SharePoint with an email notification. The answer is C. Through the secure SharePoint with an email notification. It is done this way to protect the privacy of the employee. When are reimbursement forms due? A. At the end of each month. B. Immediately after paying the provider. Or C. At the end of each calendar year or at the end of a member's medical monitoring and no later than 90 days following the end of the calendar year. The answer is C. At the end of each calendar year or at the end of a member's medical monitoring and no later than 90 days following the end of the calendar year. And make sure the receipts are attached. Remember, there are plenty of resources to support you. In the case of medical monitoring, you can find details on the PEBT website by selecting the PEBT Program Benefits menu and clicking on Member Benefits and then Medical Monitoring Cost Sharing. Congratulations! You have just completed the 5th in a series of skill-building lessons. You can now identify eligible medical monitoring expenses for reimbursement. Explain who is eligible. Locate the appropriate forms and submission instructions. Apply the correct process for submitting claims, including timing and documentation requirements. This concludes Skill Building Lesson 5, Medical Monitoring Reimbursements. You can find more self-directed skill building modules on the PEBT website.